that is almost last session of our parallel session of Public Health Foundation. Today's theme is non-communicable disease. You all know that world is really suffering from the problems with COVID-19 nowadays. However, non-communicable disease was really a burden before the COVID, and nowadays this is really a big challenges and big burden for us. So we have to combat with these diseases. So we will hear almost 6 presentations from our 6 presenters. So I am now going to introduce today's session chair, Professor M.S.A. Mansoor Ahmed sir. He is professor and advisor, Department of Non-Communicable Diseases, Bangladesh University of Health Science. And we have also Professor Nauzia Yasmin, and I am moderator, Dr. M. Islam Bulbul. Most welcome to all of you. And today's we have 6 presenter, Ms. Rafia Rahman. She is Assistant Professor, Institute of Health Economics, University of Dhaka. Then Sujana Haq Choudhury, Lecturer 1, Department of Public Health, Northern University, Bangladesh. Then we have Muhammad Robiul Islam. He's the lecturer, Department of Health Promotion and Health Education, Bangladesh University of Health Science. Then we have Naushin Jabin. She is intern physician, Chittagong Medical College Hospital. We have Arun Shahi. He is a consultant of medical oncology, Patan Academy of Health Science, Lalitpur, Nepal. So last but not the least, we have Sabbir Ahmed Osmani. He's student Shohid Ziaur Rahman Medical College, Bogura, Bangladesh. So with this, I would like to hand over to Professor M.S. Mansoor Ahmed and Professor Dr. Nauzia Yasmin to chair this session and to moderate this session. Sir, please, madam, please. Sir, could you please unmute your microphone?
Oh, sorry. Yeah, thank you. Yeah, thank you very much, Dr. Bulbul. We are very welcome on behalf of Public Health Foundation Bangladesh. I welcome you all to today's session. And today's session is the non-communicable diseases. Although we are very much concerned with the COVID-19, but non-communicable disease is also an important issue in this COVID-19. Professor Nauzia Yasmin, Chairman of the Public Health Department of Public Health, State University, is with me as co-chair. I welcome Madam to our today's session. And today we'll discuss on non-communicable diseases. I have seen the title of the topics. Mostly they are concerned with communicable disease, but there are some presentations those have some relation. They have shown COVID-19 relation of non-communicable disease with COVID-19. So non-communicable disease is a very, it's a very important issue for the present time, and because 71% people globally is affected by non-communicable disease, and 4 non-communicable disease, that is cardiovascular disease, diabetes, cancer, and COPD, is responsible for about 80% of all premature deaths in the globe. And mortality is more among people who have comorbidities of NCDs. that is COVID-19. It is found that the mortality is more due to COVID-19 who are older people eventually who have non-communicable diseases. So we are very much should be very much careful, and we should address the NCDs if we want to combat the COVID-19. So it is very important to know about how can we reduce mortality by taking proper care of the COVID-19. Anyway, I am not going further, and I request my co-author, Professor Nozla, to say something. Then we will start our presentations. Thank you.
Thank you very much, Mr. Amit sir. It's a pleasure and it's a privilege for me to be here as a co-chair with you. I congratulate Public Health Foundation Bangladesh for arranging such a timely and conference in this pandemic, in new normal situation, in Zoom. Because every year I always participate. Every year they arrange this conference, but this time it's on online platform because of this pandemic. I'm really thrilled to listen to all of you, and I'm really glad to see one student also presenting. I know Rafia for a long time, and I really am also happy to see Arun Shahi from Nepal, because I've got a lot of students who are in Nepal, like who are Nepalese. So I really appreciate, and I think I'm not going to linger anymore. I welcome you all in this session with me and Professor Ahmed, and I think we'll start the presentation. Thank you very much. Welcome to the session.
Thank you. Okay, so let's hear from Mr. Rafia Rahman, and her topic is reduce complication of diabetes among female patients, concern for developing and LDCs. So Rafia Rahman, please.
Thank you, sir. Thank you, sir. Should I start?
You please start, Rafia. You start.
Yeah, madam. I'm ready.
Okay.
Okay. Thank you, sir and madam, and very welcome. Bismillahirrahmanirrahim. Assalamu alaikum and very good evening. Dear organizing committee, panelists, and distinguished attendants, me, Dr. Rafia Rahman, working as an assistant professor at Institute of Health Economics in University of Dhaka, going to present my paper on reduced complication of diabetes among female patients, concern from developing and least advantaged countries. Next slide. As we know, diabetes mellitus is a group of metabolic disease in which a person has high blood sugar due to problems of processing or producing insulin. It can affect anyone. Individuals diagnosed with diabetes tend to have increased risks of stroke, heart disease, retinopathy, peripheral nerve damage, and renal problems. Addressing the growing concern about escalating health threat by diabetes with support from WHO, International Diabetes Federation, established in year 1991. And in year 2006, World Diabetes Day became an official UN official day. Next slide. In snapshot, we are seeing, next slide, please. The mentionable fact in global overview is in 2014, WHO estimate that 422 million adults living with diabetes mellitus in the globe. 80% of the people with diabetes live in the low and middle income countries, and 183 million people, it is almost 50% of the total 183 million people with diabetes are undiagnosed. Regard regional overview, we see 78% of the people with diabetes mellitus are undiagnosed living in Africa. And the 2015 WHO Southeast Asia region found that 1.2 million deaths caused by diabetes, which is the second among all 7 international diabetes federation regions. Next slide, please. Next slide. And in the year 2015, WHO declared that there are currently over 199 million women living with diabetes and projected to increase to 13 million by year 2040. 2 out of 25 women with diabetes are of reproductive age, accounting for over 60 million women worldwide. Diabetes is the 9th leading cause of death in women globally, causing 2.1 million deaths per year. Women with type 2 diabetes mellitus are almost 10 times more likely to have coronary heart disease than women without the condition. Next slide. On World Diabetes Day 2017, WHO and its joint partners around the world highlight to women's right to a healthy future and campaign to promote affordable and equitable access for all women with diabetes or at risk of diabetes to the essential medicines and technologies, self-management, education, and information they require to achieve optimal diabetes outcome and strengthen their capacity to prevent type 2 diabetes. Diabetes mellitus incidence can reduce with the close concern and notice the risk factor through increased knowledge, attitude, and practice in women. Next slide, please. The aim of the study is to assess the perception of diabetes mellitus in female patients. The objectives of the study was...
Just 1
No,
minute.
go to the previous slide, please. Previous slide is objective actually. Synchronize, please, with our presentation. Okay, go ahead.
Okay. The objective of the study was to assess the knowledge, attitude, and practice regarding risk factors regarding diabetes mellitus among females, to determine cap regarding diet and discipline, self-treatment, education, and control blood sugar, and to exhortation policymakers emphasize on BCC or SBCC for reduction of incidence and complication of diabetes mellitus among females. Next one, please. The method and material was a hypothetical strategy was developed first, then a structural questionnaire was developed for face-to-face interview, and the patient diabetes book or their prescription was checking, and the 2 facilities, one is from Dhaka National Medical College and Hospital, and Diabetes Center Wari was taken as a study facility. Sample was taken purposely and it was selected purposely, and a total 8 women, 40 working and 40 was a housewife. Their age was 42 to 45 years, and SPSS and Excel was used for data analysis. Next slide, please. This is the hypothetical strategic framework where I show the risk factor in the violent color, and then cap regarding the 4 category.
Rafia, you go to the result, please, because you are running.
The result and discussion is the perception on before onset of the diabetes mellitus, and there were 8 question was said there: the eating sugar, eating excessive sugar, eating excessive rice over body weight, fat in blood, regular exercise, and regular intake of fast food and food adulteration. The mentionable fact or interesting fact is there: most of the housewives are thinking that food adulteration is the cause of diabetes. On the other hand, they also think that the just eating sugar causes the diabetes, but both category are think that over body weight is responsible for diabetes, and the fat in blood, it is also important for onset of diabetes and other non-communicable diseases. But housewives, those who are working in the home, they are not more concerned on that. Regarding the women risk factor before the onset of diabetes, we see
6 minutes
that
up.
Yeah. Actually, what you are telling is not shown in the screen. So go to the conclusion, please. Go to conclusion slide.
Please
Do you
go
have
to last slide.
Yeah, I think presenter can do the change the slides herself, and it will be probably good.
Raj TV, can you go the result slides? Okay.
Conclusion.
The result slide. Go to result. Yeah.
Conclusion.
Yeah. Conclusion. You go to conclusion, please. Yeah.
Next slide.
The other slide. Complication.
Next one.
এর আগের স্লাইডটা অথবা পরের স্লাইডটাতে যান দেখি
পরের স্লাইড
আর পরে
স্যার আগের স্লাইডে আমি সবগুলো এটা হচ্ছে কনক্লুশন স্যার কোনটা বলবো
কনক্লুশন
হ্যাঁ আপনি শেষের আগের স্লাইডটাই যান ওটা কনক্লুশন
হ্যাঁ ইয়েস এটাই আমরা জানতে চাচ্ছি দি কনক্লুশন
এরপরেরটা যান এইটা
কনক্লুশনটা বললেন না
স্যার এটাই কনক্লুশন এন্ড রিকমেন্ডেশন ভাই আগের স্লাইডটায়
হ্যাঁ এইটা বললেন এটাই কনক্লুশন
এটা একটু রাখেন There is hardly any study in this context. It is important to know concept and cap on diabetes among female diabetes patients in developing countries like Bangladesh. Adequate knowledge of diabetes is a key component for diabetes care and reduction of burden of disease. Hypothetical strategic framework will assist policymakers to think about create a behavior change communication material to improve knowledge, attitude, and practice for female. It is very time demand for policymakers to create new policies and strategies for prevention, management, and control of diabetes and burden. Complications developed secondary to diabetes. It is also increase awareness in women regarding
Next slide. Okay.
Next one, please. And thank you.
Okay, I think we were finished. Thank you very much, Rafia, for your nice presentation. Those who have questions for Rafia, please keep it in your mind, or you can mention the chat part your question. Right? Yeah, Bulbul. Whether they will raise hand or they put their question in the chat.
Sir, they can raise hand or also they can post into chat. Both options, but after finishing all presentation.
Okay. So thank you very much, Rafia, for your nice presentation. And I think we can, Professor Nozia can invite the next speaker.
Thank you very much, sir. The next speaker is Susanna Haq Chaudhary, lecturer, Department of Public Health, Northern University of Bangladesh. She is presenting on unmet supportive care need of breast cancer patients in Bangladesh. I welcome Susanna.
Assalamu alaikum, sir. Hope I'm visible to you all. Sir, I am starting my presentation with sharing the screen, if you allow me.
Okay.
Is it visible to you, sir?
Yes, but you go to presentation mode. Go to presentation mode.
Slideshow, yeah.
Yes, slideshow, right. Okay.
Yes, sir.
Nice, okay.
So, yes, sir. So, good day to you all. I am Dr. Susanna Haq Chaudhary, as ma'am already mentioned, lecturer in Public Health Department, Northern University, Bangladesh. I welcome you all in my presentation. Today I am presenting unmet supportive care need of breast cancer patient in Bangladesh. First of all, I want to just tell you a bit about what unmet need is. Unmet need is something that patient report themselves that they still need help with all these issues. That means after being diagnosed with cancer, there are still some issues that they still need help. So moving to background, I will like to point upon two things only, that breast cancer is the most prevalent cancer among Bangladesh women, which I have already mentioned, 19.3 per lakh population in Bangladesh, which is really a latest data. And I have also mentioned that the survival rate, you can see I wrote that 90% of population after getting adequate treatment in proper time will survive at least 5 years. So which is a long time, we can say. Like after being treated with cancer, they can live long 5 years with that cancer stages. So this is the background, and moving to the rationale, which will be the driving force why I did the study. See, you can in the picture that life with cancer and life before cancer is two different scenario. Breast cancer patients are patient who are survivors faces a lots of difficulty regarding consultation from medical providers, regarding some physical issues, then psychological, later on it comes with sexual relationship, then burden start with economic issue. So all these matter accompaniedly affect their needs. Day by day these unmet needs get rises, and which in turn affects the outcome of the treatment. This is only was the driving force why I conducted this study, because I want to see what are the unmet needs they really face and which might also affect the treatment outcome, so we can plan an intervention accordingly. So moving to the aim and objectives, my study is really a simple, small study, but I wanted to pull out some important intervention thing that we can plan for further life or further treatment protocol, which is uh, identify the pattern of unmet need, which is reported by the breast cancer patient, at the same time to measure the predictor. So what are the socio-demographic factor which force them to arise those unmet need? These two objectives was in my study. Okay, moving to the method, I will want to highlight 2 points that study place. I hiddenly did one thing in this study, that I divided my whole population into two groups. A group from public cancer treatment center, a group from private cancer treatment center. I chosen two government treatment center and two private treatment center. And inclusion criteria of my study was 18 years of age or above breast cancer patient who will diagnosed minimum 2 years back. So I gave emphasis on the year because with the time patient will realize that this is the need, this is the thing they need help. So with time they will realize what is the unmet need. So inclusion criteria was an important thing for me. So I have decided minimum 2 years of survivorship. Then data collection method was simply like all other study, pre-tested semi-structured questionnaire and checklist and other questionnaire. Okay, my questionnaire was designed in 5 domain. My domain was physical, health system and information, psychological, patient care and support, and sexual. I have pulled out all these domains to figure out the needs of the patient relevant to this domain. This was my questionnaire and scoring and domain. Moving to the analysis, I have marked red that descriptive component was frequency and percentage to see the unmet need and predictors, as I already mentioned in objective. Now, the most important and interesting part of my study is the result. I figure out 10 top most unmet need that I found in my study. Among 5 domain, I found in 3 domain, there are top 10 unmet need. Among these 3 domain, only in 1 domain, there is highest need. which is information need domain. That means in our country, patient reportedly complain consultation, giving information, giving them time, giving them explanation. So in health system and information domain, I guess you are it is visible to you that items in item number 1 there is being treated like a person just like another one. Maximum patient from private sector complain they are being like treated just a simple patient came in their hospital and getting treatment. They are not receiving that sympathy from anyone, from nurses or doctor, anything. They also state that in number 2 point, not given written information about important aspect of their care. Cancer itself is a burden. When they will receive a chemo or a radio or mastectomy, they need proper explanation of that therapy, of that treatment protocol. But they complain that they don't even receive a single written information from the consultation. Number 3, not given explanation of those tests for which they would like explanation. They asked for explanation from doctor, but doctor refuses or ignored or didn't give them enough explanation. In number 4, not adequately informed about the benefits and side effects of the treatment. I would like to point the fact that when I will receive a therapy or a treatment, I would like to know what will be the benefits so that I would be bit calm that yes, I'm in a right path. When I will not receive this kind of consultation, I will be worried and a treatment outcome may be also bad. So fourth was information issue regarding side effects. And number 5, maximum patient from private sector complain that they don't have a single person in hospital with whom they can share their feelings. They can say what they are having going through in these treatment phases. So these are the most 5 reported highest unmet need in terms of prevalence. So rest of 5 was from physical and daily living and psychological need. This is the prevalence sector of my study. Moving to the predictor, I found surprisingly that treatment, that ongoing complex treatment was a predictor for unmet need. That means patient, yes.
আপনার সময় আর 1 মিনিট আছে, যদিও আমাদের ওভার হয়ে গেছে।
জি, treatment sector, chemo, mastectomy, radiotherapy, the patient who receive all the complex treatment complain more need. And the private sector, the patient, 100% patient from private sector complain they need most with unmet need. Occupation, housewife reported more unmet need. In marital status, widow and currently married. Currently married stated they need with sexual need. Okay, moving to the conclusion and recommendation, I would say that in near future, we should add individual need assessment in every treatment protocol so that we can figure out what are their needs and we can treat them accordingly. We should pay more time on consultation. These are some references I took. I hope I have made clear what my study is. And thank you so much for your patient hearing, sir and ma'am.
Thank you very much, Suzana Chaudhary. It's a very nice presentation, and the topic is very uncommon.
Interesting.
I would say interesting, yeah. And also, like, this is the problem of our health system. We all know, because the overpopulated country, we can't give time to the patients. This is a common problem, I would say. Thank you very much. Now, Professor Mansur Ahmed.
Yeah, thank you very much. Rabiul is will present after at the end. Now I would like to call Naushin Jabin on her topic span of knowledge about cervical cancer vaccination in urban women folk, Bangladesh perspective. So, Naushin Jabin, please.
Assalamu alaikum, everyone. Am I being heard well?
Yeah, you are heard well.
Thank you. So is my screen audible? I mean, screen is
Yes, visible. You can continue.
visible.
Yeah.
Thank you so much. So I'm Dr. Naushin Zabin, currently working as an intern doctor in Chittagong Medical College. And my study is on the span of knowledge about the cervical cancer vaccination in urban women folk, Bangladesh perspective. So as we all know, I mean, cancer is a huge burden in our health system. And it is estimated that the new cancer cases is about 12.7 million is going to rise to about 21.4 million by 2030. And cervical cancer is the fourth most frequent cancer is women and estimated to be 570,000 new cases in 2080, representing about 7.5% of all female cancers. And it is so ironic that one woman is dying in every 2 minutes. And according to the reports of WHO, 90% of these deaths from cervical cancer are from middle and middle countries. I mean, being one of the from middle income countries, we do have cervical cancer as the second most cancer, and with documented 6,500 deaths every year. I mean, it's a great irony where the developed countries are gradually decreasing their rate and incidence. We are still lagging behind in this sector. And they are just doing that by maintaining their preventive measures like adequate screening and vaccination strategies against the human papilloma virus. So, to combat this crisis, WHO has recently taken a global strategy which mentioned that they want 90% of the girls to be vaccinated the HPV vaccine by the age 15. And if I do focus on the study, have very less, very less knowledge, even in the urban women. Let alone in the rural population. So my aim of the study was to evaluate the knowledge regarding different aspects of cervical cancer vaccine and its vaccination among the urban women folk. What was the condition in 2011 and what it is in 2020, and also the investigating the factors that are working behind the failure to avail vaccination. I also wanted to correlate the vaccination attaining tendency among different group of educational status, socioeconomic status, and different professional status. So my study was a cross-sectional study which I conducted on Chittagong Medical College and conducted on April to August 2020, and I included all the women from the age range 15 to 65. And I have many inclusion and exclusion criteria, maintaining which I collected my data through an online pre-tested structured questionnaire. And my sampling technique was convenience type of non-probability sampling, and my sampling size was 3,747. And I analyzed my data through the SPSS 23, and all with 95% confidence interval, my statistical tests were done. So what my results came out. In my result, the mean age of my respondents were 25.72 with the standard deviation 8.51 years. About 67.8% of my respondents had the educational status above higher secondary level, and 74.1% came from the middle class population, and where about 20.6% of my respondents were from higher middle class. So let's see what are the findings from these, quite affluent society. So in my population, about 68.7% were student, 18% were housewife, and 13.3% were from working women. So as we can see, 77.3% know about the cervical cancer as one of the leading causes from cancer. Cervical cancer. That's really a good finding, but 66.7% of them had no concrete idea what can be the symptoms of cervical cancer. And it also revealed that 25.6% couldn't even mention any risk factor of cervical cancer, and where 24.4% could at least mention human papillomavirus as an etiological factor for cervical cancer. So we asked respondents that what they know about the vaccination. 49% responded that they even don't know that there is any available vaccine for cervical cancer prevention. And very relatively, 86.3% never availed any vaccination, and 6.5%
আপনি 1 মিনিট সময় পাবেন
availed the vaccination
নওশীন
but
যাবেন
didn't complete the course.
Go to the
exactly.
conclusion. Go to the conclusion, please.
And more than so my conclusion is that the knowledge regarding the cervical cancer in
Show this slide please, conclusion slide.
Vaccination is really poor among women in our country. And so and the conclusion, is it being
So what is your conclusion?
So to combat the incidence of cervical cancer, we must stress to written among and the screening protocols, and screening should be feasible.
তো মাইক সমস্যা হচ্ছে কি মাইক কাজ করছে না
মনে হয় স্যার হ্যাং করেছে
ওনারটা বোধহয় হ্যাং করেছে
so far জি স্যার so knowledge এবং combat so I think আমরা পরের
well okay thank you I think I can go before we switch over to next. Thank you very much, Naushin Jabin. Fortunately, I am lucky to say that Naushin is from Chittagong Medical College, from where I got my MBBS. Thank you, my dear Kibola Jai. Amra ek jagah te pass korechi. Yeah, for your nice presentation, and actually you highlighted the important issues regarding knowledge of the concerned women. And yes, you have rightly pointed out that it is important. It is the second most common cancer among women of Bangladesh. That's true. And actually, there are a lot of things. Lack of awareness is very much. There are factors related with it. So I think your recommendation will be useful for the policy planners for reducing the cervical cancer among women. Thank you very much. So to Professor Nauzia, please.
Thank you, sir.
To invite this next speaker.
Okay, thank you. The next speaker is Arun Shahi, Consultant of Medical Oncology, Patan Academy of Health Sciences, Lalitpur, Nepal. And he is going to present on managing cancer care during the COVID-19 pandemic and experience from Nepal. It's a very timely. I welcome Arun Shahi. Your time is 6 minutes. Thank you.
Thank you, ma'am, for your very kind introduction about me. Honorable chairpersons, respected moderator, dear colleagues, salam alaikum and good evening from Nepal. Bangladesh is always, I feel like this is my second home, because whatever I am, whoever I am, because of Bangladesh. I did my 2 of the very important degrees from Bangladesh. That is one MD in medical oncology and MPH in epidemiology from North South University and Bangabandhu Sheikh Mujib University, respectively. So today, I'll be talking about 2 important issues of the society. One is COVID-19 and another is cancer. So today's because of the time limitation, it will be like more like experience than epidemiological study. So this is our country, Nepal. This is the country, Nepal. In a map, it looks like this, and it's not very far from Bangladesh, very near, maybe 35 kilometers from one of the eastern border of Nepal. So to get into the introduction of my topic, like COVID-19 pandemic has disrupted the spectrum of cancer care all over the world, not only in Nepal, so that it has delayed the diagnosis of cancer, treatment, and even the clinical trials. You know that there is no, till now, there are very less specific drugs in cancer. So for that, we need to do the clinical trials and research. This has also halted that one. And in response to this problem or limitation, healthcare systems are rapidly reorganizing to solve in a better way, while by minimizing the exposure of the COVID-19 infection as well. So if we talk about COVID-19 and Nepal's relation, the first case was diagnosed in January 13, 2020. And this case was from one of the students who was studying in Wuhan, China. Because of this breakout, he came to Nepal, and when he came to Nepal after 1 week, he presented with a cough and fever. And then when they diagnosed, send the throat swab and sent into the Hong Kong, and they found out that it was the COVID-19 positive. So this is the first recorded case of Nepal. So if you see what are the status till now in COVID, there are like altogether 243,000 diagnosed cases, and very interestingly, male are more frequently diagnosed than females. And if you see which age group, if you see, we are knowing about all the age groups. Who are very old, they are infected with the COVID-19. But contrast to that, in Nepal, most productive age group, that is 21 to 30 and 31 to 40, that age group is highly infected. More number they are infected. So again, in that age group also, male are more vulnerable than the females. What about the mortality rate? If you see the mortality rate, there is very, very less. It's only 0.67%. And yeah, it's a very good news that 94.11% are recovered, and only 5.21% has infected, and they are still active case, you can say that. So, which is like kind of good news for us. So if we see regarding the cancer, what is the scenario of cancer care? Like, I work in 3 hospitals, and I have tried to collect the data from the 3 hospitals. In Patan Academy of Health Science, this is a government hospital where I am working as a full-time consultant of medical oncology. In every year, we have a 1,000 plus cancer patient. They're coming there to treat. And there are 2 other private hospitals, but both of them are the tertiary cancer hospitals. In HAMS hospital, in a year, 200 plus patients we see. And in BNV hospital, we see 300 plus patients. So what are the services offered here? We offer cancer chemotherapy, cancer surgery, radiotherapy, palliative care, and others. That means like hospice care and end-of-life care. So during this pandemic, we have seen only 82.9% of cancer patients out of almost 1,500. That is only 204 patients. This is the chemotherapy, and only 4.9% went on surgery, and 4.5% received the radiotherapy, and for the palliative care, only 2.8%. So why they are missing treatment, or what is the missing rate? So we categorize them in 3 groups. One are, even with this pandemic, they are in the regular basis. They are taking chemotherapy in a regular basis. And one, because of the fear, or maybe because of the, secondary infection, or maybe they heard something. So they have kept in a category who missed less than 2 cycles of chemotherapy. Because in cancer treatment, we give a chemotherapy in a cycle. Some cycles are weekly, some cycles are 2 weekly, some cycles are 3 weekly or 4 weekly. So we did not differentiate which cycle they missed, but we have missed that any cycle, like if they missed 2 or more cycles, or less than 2 cycles. So those patients who missed less than 2 cycles were 30.89%, and more than 2 cycles, there are few, 8.1%. And those, even with this pandemic, they are taking 60.9% are taking regular chemotherapy on their scheduled time. So what about the outpatient visit? We had almost 1,000 cancer patients in this hospital who are visiting as a OPD basis, and 20% had canceled their personal visit on their scheduled date, and 50% has minimized their personal visit. Maybe they have postponed it, and 30% has continued their OPD visit as prescribed as by the physician or oncologist. So what about the patient? Like, because we have a government hospital, there is a crowd, so they were afraid maybe. So we try to find out whether they are taking consultation from other hospitals, or maybe from this virtual way, or maybe from the abroad. So we found out that 50% are not taking any advice from the other centers. Out of them, 10% we found out that they have been taking the advice from the nearby colleagues or maybe from the different country or online. And we are not sure about the 40% people whether they're taking or not. They were not available at that time. What about the COVID-19 and cancer patients? We found out that 20 patients were diagnosed with a COVID-19 and cancer. Out of them, 70% lost their life because of the COVID. So we all know that the diagnosis has been delayed because of the those staffs have been diverged into the COVID-19, to cure the COVID-19 pandemic. So the screening program of the breast cancer, cervical cancer, and colorectal cancer had been halted all over the world. Same in a surgery case, because we have to sanitize the instrument and all those things. Because of that reason also, surgeries has been decreased. But emergency surgery like perforation, obstructed bowel, active bleeding we are doing that. And radiotherapy, you know that radiotherapy is one of the main backbone of the cancer treatment. But even because of this COVID-19, radiotherapy rate has also been decreased. And systemic therapy like chemotherapy, we know that these are the cytotoxic drug. They help in immunocompromising.
So time is over almost. Yep.
Thank you. And even because the research and everything has been halted. So what we want to say is like, yes, there is a COVID-19 pandemic, but because of the COVID-19 pandemic, the cancer care should not be compromised. We need to find out diagnostic and treatment pathways to minimize the exposure and also to poor outcome from the SARS-CoV infection. Cancer services need to be reorganized to protect patients' cancer and allow the resumption of the cancer surgery. Thank you very much for the opportunity. Thank you, everyone.
Thank you very much, Arun Shahi, for your excellent presentation. It's a problem in all the countries of the world. Like this pandemic has halted our life and it has changed a lot of things, but we have to, you're right, absolutely. We have to adapt new normal situation and continue with our lives during this pandemic. Thank you very much once again. Professor Mansoor Ahmed, next presenter. Unmute করতে হবে স্যার.
Yeah, sorry. Yeah, thank you. Yeah, I am with Professor Nauzia. What she commented about the presentation of Arun Shahi actually is an important concern. And so I will now switch over to next presentation, Sabir Ahmed Usmani. And very important thing is that he is a second-year student of Shoaib Ziaur Rahman Medical College. Very welcome. We are having, I think, the youngest presenter today, and his presentation is nutritional aspect with impact of LCD's progression in South Asian countries. A review. Okay, Sabir, we want to hear from you. Please go ahead.
Sir, am I audible?
Yes, you are. You are.
Is my screen visible?
Yes, we see your screen.
Okay, thank you. Thank you, respected juries, the chairs, and the panelists for giving me this chance, and warm welcome in this platform. I'm Sabir Usmani, or Sabir Ahmed Usmani, from Shahid Ziaur Rahman Medical College, second-year student. First of all, I want to thank Public Health Foundation for giving me this chance to present myself. My study is about a nutritional aspect with impact on non-communicable disease progression in South Asian country. It's basically a review study. I have tried to review a couple of literature. I have tried to review a couple of research that have been conducted before. So this is all about a review, and I want to make a view that how the situation of South Asia is in terms of nutrition and non-communicable disease. Okay, so the background of my study is that we know that South Asian countries are in major crisis in terms of nutrition and other challenges. We know that even the rural and urban people both are getting these diseases every year, and the more common diseases are like diabetes, obesity, anemia, cardiovascular disease, and dyslipidemia. This is striking us hard, and from a recent study we have seen that 8.5 million people live with NCDs each year in Southeast region. So like I have said that India, Pakistan, Bangladesh, Nepal, and Sri Lanka, or I can say that the southeastern region, they are in the highest prevalence of non-communicable disease, and they and there are a lot of factors for this associated with non-communicable disease. But every research I have gone through, they have said that the nutritions or nutrients are one of the most vital markers for NCD progression, especially in the South Asia. So my study, my aim is to understand the non-communicable disease progression, its severity, and in major South Asian countries associated with nutritional costs, as well as to get the epidemiological picture to how to determine the different risk factors, combining all the studies and a country-based result, basically. So the methods I have used is obviously extensive literature search I have done, and I have selected some keywords like obesity, cardiovascular disease, diabetes, anemia, iron deficiency, and many more. And I have used databases like PubMed, Cochrane Library, Google Scholar, and my data were covering from 1996 to 2016. And all the countries from southeastern region, I have tried to collect data, and also the data were categorized into a lot of age groups. So all original review articles were included in the study, and additional data were collected from WHO, FAO, USDA, World Bank, and other surveys. And these review articles were based on different set of studies, like there were case control studies I have found, there was cross-sectional and randomized trials. So the result. So first of all, it's going to be a vast, but I have tried to minimize it, or I tried to make it a brief, like from the last 2 decades, especially in the last decade, there has been a vast amount of changes in the dietary style of South Asia, because there were nutritional transition, because we were taking reduced fruits and reduced vegetables, and at the same time, in India, we have seen that the number of vegetarian are increasing. And also, we have seen in South Asia, excess consumption of fast food and soft drinks are rising. So they're showing that 6% increase in fat consumption in India and 12% increase carbohydrate consumption in India from the last decades. And also, if we want to see the vital association, we will see that how undernutrition is affecting us, like it affecting our growth, our development. And there is a study they have found that the babies who are smaller in size, they are suffering from undernutrition, and in the later half of their life, they are more prone to cardiovascular diseases. So this is a good finding, and at least we know that this is a common thing, like the rate and processed meat increases the risk of obesity and cancer. So South Asian person are in the risk, as well as they have rise in high blood pressure, high blood cholesterol. So a study found that 80% population doesn't eat sufficient amount of fruits. So these all are rising micronutrients deficiencies in our body, also nutrition deficiencies. So I have tried to cover a couple of nutritions and nutrients, like vitamin A status in India. We can see that 62% preschool child are suffering from vitamin A deficiency. 84% were not even meeting the 50% of the RDA. In Pakistan, 5 million child under 5 age affected with vitamin A deficiencies. And in Bangladesh, we are seeing 51% of pregnant women had vitamin A. So the outcome is high prevalence of xerophthalmia we are seeing, also corneal ulceration, and as well as night blindness. Also, I have in the table, I have said about non-reproductive and reproductive women, the rate. So zinc is another important micronutrient, and overall prevalence in zinc in South Asia, we have seen the zinc deficiency in South Asia is 30%, which is giving rise of high prevalence of early pregnancy and growth impairment. Also, I have given in the table that how the country is affecting, like how the deficiency is working here. So it is also the anemia and the iodine status. Like if I want to say that nearly 95.5% pregnant and 64.5% children are under age 5 reported to be anemic due to this iron deficiency. And also there were 71% of different studies or different populations suffering from iron deficiency in Bangladesh, basically. So this is the iodine status in Bangladesh and iron deficiency anemia status. So this is the conclusion.
Last minute.
Okay, so we are seeing that all these things, this is the micronutrient deficiencies, but we are seeing the most important thing is that 60% of the world cardiovascular patients are from South Asia. And also there is a high prevalence of diabetes too and overweight. So we are seeing that we can say by 2030, studies say that 72% of the population are going to account for the mortality in South Asia. and 5% increase in non-communicable disease prevalence in Bangladesh. So we are seeing this is rising. So this is a discussion session. I have said that India, Pakistan, Nepal, Bangladesh, they are trying to prevent it, but still they have some endemic areas. But Sri Lanka's performance is good. I have found that. So this is the discussion portion. So in the conclusion session, I want to say that there are a lot of diseases like cardiometabolic obesity I have found. Also the micronutrient deficiencies. This is the biggest problem, and this is prevailing. So, and especially to the children and women. So as there is significant amount of people living with malnutrition and other vitamin deficiencies, the problem should be assessed with more focus. Increased awareness as well as region-based strategies should be taken. Also, we need to take consideration about socio-demographic factors and also take some preventative steps. And we need to consider the most important thing, I guess, is about the dietary transition of the South Asia, because we are going to intake more and more carbohydrate and fatty foods on not taking in of vegetables. So thank you. Any question, please?
Okay, yeah, question and answer will be later on. Thank you, Sabir Ahmed, for your nice presentation. Can you hear me?
Yes, sir.
Yeah, okay, yeah, thank you. As a beginner, I appreciate your research work. Although I was expecting that you will mention what kind of review it is, whether it's a systematic review or it's a meta-analysis, and what what were the criteria for selecting these studies, and you have it would be better if we could see more in tables. You have shown only one table, and others are descriptive, which was sometimes difficult for the audience. Anyway, thank you very much for your study. So next, over to Professor Nauzia.
Thank you very much. The last presenter, last but not the least, is Muhammad Rabiul Islam, lecturer, Department of Health Promotion and Health Education, Bangladesh University of Health Sciences. And he's going to present on sex differences in stroke care and outcome at 2 selected hospitals in Dhaka, Bangladesh. Please welcome Muhammad Rabiul Islam. Your time is 6 minutes. Slideshow, please put on the slideshow. Thank you.
Can you hear me?
Yes, we hear.
Is everything okay? Can you hear me?
Yes, so far I am concerned, I hear you.
Yes, we hear you. Go ahead.
Yeah, thank you. Honorable teachers and listeners, welcome to the presentation. I am Muhammad Rabiul Islam. I am going to present one of my research work, which title was Sex Differences in Stroke Care and Outcome at 2 selected hospitals in Bangladesh. Let's move to the background additionally. Stroke is one of the leading causes of death and disabilities worldwide, which is account for the 3rd leading causes of death in Bangladesh, and it is around 6%. And a number of different studies shows that seeking treatment and coming to the hospital among male and female stroke patients varies due to a number of different factors, such as personal, social, economical, religion, and other factors. But it is uncertain that whether stroke affects male and female similarly or not. And a number of different studies has been conducted, but most of them were based on secondary data. So based on the primary data, this study was conducted to explore the differences in care and outcome of stroke between male tertiary level hospitals in Bangladesh. And the specific objectives of this study was to find out the risk factors of stroke between male and female patients, and to determine the outcome as well as their care receipt between.
Mansoor sir, can you mute your mic, sir?
Yeah. Okay. Yeah. I am not from my mic anyway. I am.
Thank you, sir.
To determine the outcome of stroke and its sex differences, as well as the care received in the hospital level between male and female patients. And it was a descriptive cross-sectional study which was conducted at Bangabandhu Sheikh Mujib Medical University and National Institute of Neurosciences and Hospitals in Dhaka, Bangladesh. And the study was conducted among the male and female stroke patients who were admitted in these two hospitals during the study period. But we included both male and female stroke patients, and however, we have excluded the outdoor patients in this study. And total 233 stroke patients were selected conveniently, and we used a pre-tested, semi-structured interviewer and administered questionnaire to collect their data. And using SPSS version 22 and considering 95% confidence interval and considering p-value 0.05, we used the appropriate statistical tests. And ethical approval for this study was taken from Ethical Review Board of National Institute of Neurosciences, but we have taken their written informed consent from all of the participants. And the study shows that hypertension was found the most commonly cited risk factors for the stroke patients, followed by 42% diabetes mellitus and 34% smoking, and previous stroke history was 28%. And we determined around 60% male stroke patients in these two hospitals and only 40% female stroke patients. So we can say that male are more sufferer in stroke than female. And we determined the paralysis was more common complications in the stroke patients, which was around 70%, which is 67.4%, followed by speech difficulties 53.2%, and unconsciousness around 20%, followed by eye problem 15%, and swallowing difficulties around 15%. And the least confusion and coma was found the least outcome of the stroke patients. And let's check whether these outcomes were associated with sex. Yes, we see that unconsciousness was found significant as the p-value was less than 0.05. And we see that male became unconscious due to stroke around 25%, and dependent in activities of daily living due to stroke means after having a stroke problem, female became more dependent in their daily activities than male, which was around 80%, and it was found statistically significant. Let's do a correlation test whether this was significant or not. Actually, we see that unconsciousness we found no such correlation between unconsciousness and sex, but we found that female are around 3.124 times higher chance of being dependent than male. That means female have to depend on others after having stroke to accomplish their daily activities. And if we see the
last minute,
okay, and we did not found any significant association or differences in care received in relation to sex. That means male and female patients received same care in the two selected hospitals. And the study is subject to some limitations, such as a small sample size, and these two hospitals may not be the representative of the whole country, and only indoor patients are included in the study, and we have excluded the outdoor patients. And apart from that, the study can conclude that sorry, what is the conclusion? Can you hear? The study can conclude that hypertension found as a common risk factor, and the stroke prevalence was higher among male. Paralysis and speech difficulties were the most common outcome, and female patients were more sufferer than the male patients, and male and female patients received same care in the hospitals. And we can recommend, based on the findings of the study, that organized stroke care, including adoption of quality improvement program at family level, could reduce the disabilities after stroke. And these are the references. And thank you all for your passion sharing. Thank you.
Thank you very much, Mohammed Rabiul Islam. Nice presentation, but I would say that your topic says that sex differences in stroke care and outcome. But if you could have shown us like in outcome, the difference between male and female, the sex difference in outcome, that would have been better than showing us the association. You understand my point? First, I think you have that data.
Yeah.
Yeah.
Yes,
So, so because the topic says that sex difference in patient care and outcome of stroke, right? Between, so that's okay. I think you have that. Maybe you can show us later sometime or in the question answer session. So thank you very much. Now over to Professor Mansur Ahmed. I think we are at the end of the presentation, right? Question answers. Sir, unmute.
Unmute yourself.
Unmute, current.
Oh, sorry. Yeah. Thank you. Sometimes I forget. Well, thank you very much. And it was very nice to hear from all the presenters. Now we want to hear from the audience. Any questions from the please either raise your hand or you mention in the chat part to whom you made your question. Okay, please, Bulbul, you can help us.
Thank you, sir. Even our time is also a bit
lagging behind.
Yeah, lagging behind. We have one hand, Professor Hafiz Khan, sir.
Yes.
Host, please.
Oh, he is from UK. Oh, thanks,
can you
Professor
make
Hafiz.
Professor Khan into the panelist part?
Yeah.
So that he can make questions.
Can we see Professor Hafiz in the Raj TV, please? Can you please? He's a renowned scientist and he is a professor of Dhaka University, and he is a professor working in UK.
Okay, sir. Sir, question করেছেন. His question is there any age adjustment in the model? Maybe for the last presenter.
Yeah.
For
Mohammed
Rabiul Islam, yes.
Yeah, Professor Hafiz Khan is shown.
Okay, I think I enjoyed the talk actually. It's very interesting one. So the actually we see very rare studies on stroke. In that context, excellent work. But I was interested in seeing something on age adjustment, where there is a highly likely to be a suffering from stroke when we age. Okay. So it would be an interesting one if you just try to adjust the age and see how it happens for gender, age, and other variables. Although you have a very small sample, that might not give any significant results. Well done. Excellent job.
Thank you, sir. Thank you very much.
Yeah. Thank you, Hafiz Bhai.
Thank you, Mansur Bhai. Thank you for inviting me.
Yeah, well, Professor Hafiz Khan could not be unfortunately shown in the video. I want to say some few words about him. He is also an advisor of the Daffodil University, and he is working in many research works in Bangladesh, associated with so many research works in Bangladesh. And we are very happy to have Professor Hafiz Khan in our sessions. Thank you, Hafiz Bhai, for your.
Thank you, Mansur Bhai. If anyone is interested to see more work on, so just visit Oxford Institute of Population Aging. Okay, so we are doing some work related to this field. Okay, thank you.
Yeah, is there any other questions, Bulbul?
Still, I don't see any hands, sir. So we can move.
Professor Nausea, can you please say some concluding comment? Then I will finally conclude this session.
Yes. Thank you very much, all the presenters. It's a really nice presentation on different topics. Like first, Rafia presented on diabetes on female. Then Susanna presented on unmet needs of breast cancer care. Like we know that these are all the very common cancers or common non-communicable diseases of our country, and it's rising, and we have to be more alert than this pandemic. I mean, I'm sorry to say, the communicable disease, we must be we must be aware that we should be careful, but non-communicable diseases are part and parcel of our life. Even we want to prevent and we take preventive measures, it's really difficult sometimes to prevent because some are dependent on genetic factors. We all know that, not in our hands all the time. And also then there was presentation, Arun Shahi presented on cancer care during this pandemic. It's a very common problem in all the countries. We have learned a lot, like what are the absent rates, what are the present rates, like the patients coming to the clinic for care. So it was a very good presentation, and we had an idea about this whole scenario during this pandemic. And the next presenter presented on span of knowledge about cervical cancer, like vaccination. But I'm really amazed to see that the result shows that I think a lot of women doesn't know about the cervical cancer, but I don't know what's your name, Naushin. I was just wondering that you conducted this research in Chittagong Medical College. So I guess that most of the participants were medical students, right? So how come they don't know about vaccines? That really, I don't know. I was a bit disappointed to see the result. Anyway, then one of the students, second year student, presented on the nutritional aspects, that we all know that nutrition is very much associated with the non-communicable diseases. It's a secondary analysis that Sarah was mentioning, that whether it's systematic or meta-analysis, we don't know. But what I would request you, what's your name, Sabir, that why don't you do another research, a real research to justify your result? Like you have done 10 years review on the article, so now you can do a research actually to see whether these results match or not, and it will be a challenge for you. So I thank everyone. I think I covered all of them. I don't know if I missed anyone. So thank you very much. Thank you very much. It's a very nice evening, and I really learned a lot from your presentation. Thank you.
Thank you, madam, for your nice words and discussion on the topics. Actually, there is, I think, nothing left for me. Still, then I want to say a few words. Rafia Rahman, her presentation was actually reduced complications of diabetes among female patients. But later in the presentation, she showed it's a CAP study. And she said the reduced complication of diabetes among female patients, and it's a concern for developed and LECs. I think the topic should have been misleading, because if there is reduced complication of diabetes, why it should be a concern? I don't know. If it is an increased complication, then it would have been.
Sir, can I supplement some words?
Yeah, you can.
Sir, the theme of the study is the incidence and the complication of diabetes among female patients could be reduced if the strategy, the CAP strategies say where is the lack and where we need to focus.
Yeah, I understand.
The onset. On that.
Thank you. But your title did not say like this. Your title was not accordingly. Anyway, thank you. I understand what you wanted to mean. And then Susanna Hawk's presentation, breast cancer, I think is a very important, the number one cancer in females, and she tried to find out the factors related with the breast cancer prevalence and occurrence. And it's a very nice topic. And Rabiul Islam's presentation on stroke was important, and I think he highlighted nicely as the cause of the stroke as the hypertension, and he found out other smoking and other factors as a risk factor. And cervical cancer also, Nausea, Javin mentioned very important issues. And I am happy that being an intern in Chittagong Medical College, you have done a very good study. Arun Shai's presentation is undoubtedly very nice presentation. Thank you, Arun. We hope to hear from you further researches on cancer in Nepal.
Thank you, sir.
Yeah. And Sabir Ahmed's presentation, nutritional aspect. Yeah, it's very important. Nutritional factors are always, we know a lot of factors for NCDs, but nutritional factor is also very important. We know the other factors of NCDs, 4 factors are important. One is lack of physical exercise, sedentary lifestyle, then smoking, then other factors, that is sedentary lifestyle, dietary factors is very important. So you have nicely presented all the factors, and I thank Dr. Bulbul for nicely conducting the session, and the Raj TV for nicely organizing today's session. There was actually no problem in our session. Sometimes it happens. So thanks again from the Public Health Foundation. I thank all the participants, all the audience, and including Professor Hafiz for this kind attending the session. Okay, so that's what I thank you very much. Bulbul.
Thank you, sir. Thank you, Professor M.S. Mansoor Ahmed, Professor Dr. Nauzi Yasmin. Thank you very much for your wonderful moderation of total session, as you chaired both nicely. And also thank you, Ms. Rafia Rahman, Dr. Sujana Haq, Arun Shahi, also Sabir Ahmed Osmani, Rabiul Islam, and might be the last one, if I miss, Naushin Jabin. Thank you all. It was a very wonderful and lively session. We enjoyed a lot, and we have learned a lot. A few interesting I have found, especially Sabir Ahmed Osmani. I convey my thanks, because you are really, in your age, it was really unimaginable. That is, we can't imagine that we will, make a presentation before this audience. Thank you very much. Thank you, Raj TV, for wonderful support, and Acme Laboratories. Thank you all. With this, I am going to conclude with the permission of our chair.
Yeah, okay. And please invite them for the next session.
Yes. And our next closing session will be in another link. So you have sent another link. Please join with that link in the closing session. Thank you very much, and you are most welcome.
Thank you, sir.
Okay,
thank you, ma'am.
Thank you, sir.
Thank you.
Madam, thank you very much. আপনার সাথে দেখা হবে, ম্যাডাম।
ইনশাআল্লাহ।
রাজ টিভি আমরা মনে হয় লাইভ অফ করতে পারি, so we'll move to another session.
Okay, bye.
Our Sabir, Arun Shahi, you can make journal presentation. I mean publications.
Sure, we'll do together.
Opportunity. Yeah.
Allah Hafiz.
Inshallah, sir. Inshallah.
Take care. Yeah. Thank you very much.
Yeah. See you in another session. Yeah. Thank you.
You are watching Raj TV, Jagoran.